good afternoon. My name is Ashley Sikowski, and I'm a speech therapist here at the USF Clinic.
Hi Ashley, my name is Bethany Smith.
Hi, Ms. Smith. It's nice to meet you. Ms. Smith, what brings you here today?
I'm 18 years old and I have a stuttering problem.
Okay. Well, I just want to let you know during this session I'm going to ask you a series of questions related to your stuttering problems. If at any time you feel the need that you need to re-explain something from a previous question, or if you have any questions for me, just please let me know and feel free to do so. And the session should take about 30 minutes or so.
Okay, thank you.
All right. Ms. Smith, when did you first begin to stutter?
I've stuttered since I was 5 years old in elementary school. I started attending speech therapy when I was 5 years old and continued speech therapy for 1 year.
Okay. And what type of speaking situations did you first notice your stuttering?
My kindergarten teacher told my parents that I was having difficulty answering questions in group circle time.
Okay. What type of difficulties was your teacher concerned about?
My teacher was concerned with the amount of time it took me to correctly say what I was trying to say, and also with the amount of repetitions I used compared to other students.
I see. What steps did you and your family take to pursue more information regarding your stuttering?
Well, my parents put me in speech therapy after my teacher brought my stuttering to their attention. I was in speech therapy starting at age 5 for 1 year, but my parents' insurance would no longer cover speech therapy and I wasn't stuttering too bad, so they decided to pull me out of therapy.
Okay. Well, I just want to take this time to give you some basic background information regarding stuttering as it relates to your situation. A lot of times stuttering begins in early childhood and sometimes will often persist through adulthood, as in your case, since you're 18 years old and you still stutter. And as you may know, stuttering affects the fluency of speech, so your flow, your speaking rate, disfluencies such as repetitions or prolongations of different sounds and words. So I just wanted to give you that background information. And since you haven't received any speech therapy since elementary school, how would you say that your stuttering is currently impacting your daily life?
My parents are embarrassed by my stuttering. They often ask me to repeat my sentences multiple times. I stutter the most on the telephone and in front of large groups. I'm very self-conscious about my stuttering, which is why I'm here today.
Okay. How does your parents' feelings about your stuttering make you feel?
My parents' negative reactions make me feel very self-conscious and make me feel bad about myself. I really want to be able to overcome my stuttering when talking to my parents and other family members.
I understand. Is there any other family members within your family that stutter?
Yes, my older sister Rebecca stuttered as a child.
Okay. How old is Rebecca now, and does she currently stutter?
Rebecca is 21 years old now. She doesn't stutter anymore. Her stuttering went away during childhood after receiving speech therapy for about a year.
Okay. How would you say that your stuttering compares to Rebecca's stuttering during her childhood?
Well, my parents told me that Rebecca started stuttering when she was only 4 years old. After receiving speech therapy for 1 year, her flow of communication greatly improved. So I guess my stuttering was definitely worse than hers, seeing as though I'm 18 and I still stutter.
Okay. Can you explain any medical or developmental problems throughout childhood and to present day?
My mom told me that I did not begin to say my first words until I was 18 months old. But after that, my speech and language seemed to develop normally. I also had frequent middle ear infections as a child. As of now, I don't have any medical conditions and am on no medications. I'd say I'm in good health. It's just my stuttering that presents a problem for me.
Okay. Well, I want to take this time to get your perception about stuttering. So why is it that you think you stutter?
Well, when I get nervous, it takes me a couple minutes to completely know what I want to say and to say it the way I want to. It's almost like a mental block.
Okay. What types of things do you do when you stutter?
I have the most difficulty saying S and T at the beginning of words. When this happens, it can take up to a couple of minutes to express what I want to say.
Okay. Can you give me some examples of words that are difficult for you?
Words like study and start are the hardest for me, but almost any word can be difficult depending on the situation.
Okay. Do you ever have sound prolongations? For example, see you later.
Yes, I do seem to say one sound for an extended period of time.
Okay. Do you ever have part word repetitions or whole word repetitions?
Yes, I also do have repetitions for single sounds and repetitions for different words. A lot of times I also say or before what I'm trying to say. Sometimes I also try to find other words to use if a certain word is too hard for me to say without stuttering.
I see. Can you explain any physical behaviors that you use while stuttering that are not directly related to speech production?
I usually blink my eyes rapidly or shake my foot to try to help myself overcome my stuttering. Sometimes it works, but other times it doesn't. It really just depends on the situation.
Of course. Right now, I want to take this time to give you a basic self-assessment of how you view your stuttering. I'm going to ask you a few questions related to this, and I'm going to ask you to rate yourself on a scale of 1 to 10, with 10 being the most severe, okay? The first question is, how would you rate your overall stuttering on a scale of 1 to 10?
I would say my overall stuttering is probably about a 7.
Okay. Using the same scale, how would you rate your stuttering in difficult situations?
When I'm in a difficult situation, I would say that's probably about a 9.
Okay. And on a scale of 1 to 10, once again, how would you rate yourself stuttering-wise in situations that are easier for you?
When I'm in a comfortable situations, only about a 4 or 5.
Okay. In what situations do you stutter the most and the least?
I stutter the most in large groups and with my family. I know my family members are embarrassed by my stuttering, so this puts more pressure on me to try not to stutter. I stutter the least with close friends while singing and in informal situations.
Okay. What have you done to try to eliminate the stuttering or follow up to receive more information?
I have, the previous speech therapy from when I was 5 years old. I also have done a lot of research online and read a lot of information about stuttering. The readings helped me become more aware of my stuttering characteristics and behaviors.
Okay, well that's great that you've done some research and have found out some basic information to help you become more aware of your behaviors. Can you please describe situations that you avoid as a result of your stuttering?
In my large classes at school, I avoid raising my hand to answer questions in front of everybody. When my cell phone rings, I often ignore it and then text the person back about 10 minutes later so I don't have to talk to them on the phone, since that is pretty difficult for me.
Okay. Does your stuttering vary from day to day?
Yes, my stuttering varies on the situation I'm in. As I've said, speaking in front of large groups of people who I'm not familiar with are the most difficult.
Okay, I see. What type of activities are limited in your daily life as a result of stuttering?
Well, I generally don't go out to parties with my friends as much as I'd like to. Meeting new people is hard for me because I tend to stutter around people I don't really know. Also, I'm currently unemployed because I don't want to be put in any situations when talking to people. So right now those are the two biggest factors of my stuttering affecting my life.
Okay. Has your stuttering impacted your academic achievements at all?
In high school, my stuttering definitely affected my scores on individual and group presentations. Now that I'm in college, I tend to avoid classes that I know will require a lot of public speaking or group work, but I won't be able to always do that. I'm majoring in nursing at USF, and a lot of courses require presentations related to health. Okay, I see.
During your time here with me today, has your speech been typical of your everyday communication?
I've stuttered a lot less with you here today. I have felt very comfortable with you, and one-on-one conversations aren't difficult for me, so I don't usually stutter a lot in those type of situations.
Okay. So just to clarify everything that we've talked about so far, it seems to me that your biggest concern is your stuttering with your family members, social situations, and regarding your career.
Yes. I really want to be able to lessen my stuttering and ease the flow of my communication while conversing with my family members and also with people that I do not know. I want to be able to go to social events and not worry about if I'm going to stutter or not. And also, I want to be able to express myself clearly and professionally to other people so that in the future I won't be limited as a result of my stuttering.
I understand. Do you feel that you'll benefit from speech therapy?
Yes. I currently have friends who have stuttered in the past, and they told me that speech therapy was very beneficial for them. One of the main reasons I came today was because of the positive improvements my friends have told me about from therapy, so I also believe it will help me too.
Okay. So just to let you know, this is the end of our session. Is there any other questions or anything you'd like to tell me?
No, I feel like I've told you everything.
Okay. Well, great. So next week for our first therapy session, we're going to work on developing techniques to help you become more aware of your speaking rate and develop the techniques that can be used to control your stuttering and help monitor it. Do you have any questions for me?
No, thank you.
Okay. Well, Ms. Smith, it was great meeting with you, and I look forward to meeting with you next week for a speech, and I just want to thank you for all your help today.
Yes, thank you too.
All right. Have a good day.
You too.
Thanks.